This is Pet Life Radio. Let's talk pets.
Welcome to ER Vet on Pet Life Radio. I'm your host, Dr. Justine Lee, and I'm a board-certified emergency critical care specialist and toxicologist. Thanks for joining us today. Today, we're going to be talking about blood transfusions in dogs and cats. We'll be right back after these messages.
Hey, cat people. Litter box smells always on your mind? Think about your cat, not the box, with World's Best Cat Litter, the litter that delivers big odor control in a tiny package. World's Best Cat Litter harnesses the concentrated power of corn to trap odors deep inside the litter. Ready to knock out smells and use less litter? Find World's Best Cat Litter at Target, Walmart, and in your local grocery and pet stores.
Let's Talk Pets on PetLifeRadio.com.
Welcome back to ER Vet on Pet Life Radio. Thanks for joining us today. Today, we're going to be talking about a unique topic, blood transfusions. Now, a lot of pet owners aren't actually aware that you can give blood transfusions to dogs and cats. And you're probably wondering where we get that blood from. Well, most of the time, blood transfusions are given to patients that need either red blood cells or plasma. I end up using a lot of blood transfusions or even plasma transfusions in the emergency room because I see a lot of trauma cases. So, one of the first examples where we're actually going to give a blood transfusion is a dog or cat if they undergo some kind of trauma. Unfortunately, sometimes we'll see a dog or cat that's shot with a gun or shot with a bow and arrow. Sometimes they're hit by a car. And in these circumstances, if it results in internal bleeding, we oftentimes may need to transfuse your dog or cat with red blood cells from another dog or another cat. Sometimes we'll actually give plasma transfusions if your dog gets into a certain type of rat poison that causes internal bleeding also. And so something called an anticoagulant rat poison can cause internal bleeding, and the classic sign is actually bleeding into the lungs. So if you have a puppy that's coughing or vomiting up blood, you want to get to your vet right away so they can check the gum color, check the heart rate, and check a clotting test. Thankfully, anticoagulant mouse and rat poisons are totally reversible and totally treatable with the antidote vitamin K1. But if the clotting is really abnormal, we may actually need to give a plasma transfusion to help fix the clotting. The third circumstance where I oftentimes will need to reach for a blood transfusion is when there's internal bleeding from cancer. And if you haven't already checked out our previous ER Vet episode with Dr. Craig Clifford, our oncologist, he talks about a really common type of cancer seen in older dogs, especially German Shepherds, Labrador Retrievers, and Golden Retrievers. And this is a cancer called hemangiosarcoma. This can get so big that it actually ruptures the spleen or the liver, and it can result in internal bleeding, which requires an emergency blood transfusion. The fourth cause for why we can need a blood transfusion in dog or cats is sometimes when we see a bone marrow problem. So for cat owners out there, really important if you know your cat has feline leukemia, or what we often call FELV. I always tell cat owners before they adopt or purchase a cat, you always want to make sure it's feline leukemia or FELV negative, because unfortunately, it's almost the equivalent of the AIDS virus. It's a really serious viral infection that's really contagious. And so outdoor cats that fight or have blood exchange with another cat or saliva exchange can end up catching this virus. Unfortunately, feline leukemia can actually cause cancer in the bone marrow and result in severe anemia. So sometimes we'll have to give a blood transfusion for that. For older cats, Unfortunately, we can often see chronic kidney failure. And if your cat has signs of chronic kidney failure, it typically includes signs like weight loss, excessive drinking, excessive urination, bigger clumps in the litter box, bad breath, or not eating well. With chronic renal failure, it actually causes an anemia, and that anemia can be so severe that sometimes we'll need to do a blood transfusion also. So, when do we decide to transfuse a dog or a cat? Well, there's a number called packed cell volume, and this is really similar in human medicine to the hemoglobin level. And what we're looking at is the packed cell volume. Normal for a dog or cat should be about 40 to 50%. We typically will transfuse a dog or cat if they have acute blood loss or if their packed cell volume is less than 20 to 25%. It's really going to depend on how chronic the blood loss is, how well the body can compensate, and how long the disease has been going on. So, when in doubt, you always want to check with your veterinarian or your ER vet. Oftentimes, your vet may actually refer you to the ER vet if your dog needs a transfusion, because most people aren't aware, but general practitioners or family veterinarians don't typically carry blood products in their hospital. And that's because it's quite expensive. They only last for a few weeks, and they'll oftentimes expire. So most emergency clinics and veterinary clinics always have blood products available. We'll continue with this really important life-saving topic right after these messages from our sponsors.
Does your dog itch, scratch, stink, or shed like crazy? Come to DACVECC for help. Order a 90-day supply of DACVECC. Pick up 2 bottles of Lico Chops, get the 3rd bottle free. New improved Lico Chops with omega-6, omega-3, vitamin E, and now 6 extra direct-fed microbials. Even better for the digestive tract and immune system. And dogs love it. Try Lico Chops. Buy 2, get 1 free. This is Henry Lukasevic for DACVECC.
DINOVITE.com.
Let's talk pets
Let's talk pets
on Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Welcome back to ER Vet on Pet Life Radio. Now, we've been talking about blood transfusion medicine, and you're probably wondering, if my dog or cat needs to get a blood transfusion, where am I going to get this done? And again, you typically are not going to get this done at your regular veterinarian. You're going to have to go to an ER vet or a specialty clinic for a blood transfusion if needed. Now, we really rely on donors to help provide blood products for dogs and cats. So you're probably wondering, if I have a healthy dog or cat, can they actually be a blood donor? Yes. In fact, just like humans donate blood, dogs and cats donate blood too. And most of the time, it's hospital staff pets. So a veterinarian or a veterinary technician's own dog or own cat. People are often surprised to know that dogs have 13 different blood types. And so we call this dog erythrocyte antigen, or DEA 1.1, 1.2, 3, 4, 5, and 7. And some of these are either positive or negative. So, depending on what blood type your dog is, your veterinarian or your emergency veterinarian would love if you wanted to consider having your dog be a blood donor. Now, there are actually true universal donors, and these typically are what we call DEA 1.1 negative dogs. So if you live near a specialty clinic or an emergency clinic, consider contacting them to see if your dog is healthy enough to be a blood donor. Most of the time, it has to be a relatively healthy pet. So for dogs between 1 and 8 years of age, they can't be on any medication except for their flea and tick and heartworm medication, and they have to be totally healthy and up to date on their vaccines. Most of the time, specialty clinics and emergency clinics will actually do complete blood work, and that's about $500 to $800 worth of blood work to make sure your dog is healthy enough to donate blood. If your dog does donate blood, we typically ask for a commitment of 4 blood donations a year for typically 2 to 3 years, depending on how often the clinic needs blood. What about cat owners? Well, interestingly enough for cats, you have to be really careful transfusing cats. And the main reason why is there is no universal donor in cats. In other words, cats oftentimes are blood type A, B, AB, or a really, really rare type called Mick, named after a cat, Mick. Now, if we give the wrong type of blood to a cat, it can actually cause a fatal transfusion reaction. So your cat always needs to be blood typed with a blood test before they get one drop of blood. That's because they're born with antibodies against certain blood types. That's not the case with dogs. Thankfully, with dogs, they can receive one free blood transfusion before they develop antibodies. When in doubt, consult with your ER vet or your veterinary specialist to find out if it's safe for your dog or cat to either receive blood or to give blood. Now, for cats, we oftentimes will actually sedate them if they want to be a blood donor. And that's just so it's not stressful to them while we collect some blood. It's a really, really light sedative. It only lasts about 10 to 15 minutes, and your cat doesn't have to be completely asleep for it. It's just enough to take the edge off. For cat donors, we're oftentimes looking for cats that are healthy. They have to be relatively young, so between 1 year and 8 to 10 years of age. They have to be indoor only and not on any medication except for heartworm medication or potentially flea or tick medication. The reason why cats and all the housemate cats have to be completely indoor to be considered to be blood donors is because we can't risk transfusing feline leukemia to your cat. In other words, if your cat goes outside, it's more likely to be exposed to that dangerous virus, feline leukemia, and we don't want it to transmit it in a blood transfusion. Just like with dogs, your cat will get about $500 to $800 worth of completely free blood work to check to make sure that they're a healthy blood donor. And if they are a healthy blood donor, we typically ask for a commitment of donating 2 to 4 times a year for 2 to 5 years. Most cats handle it really well. And most veterinary clinics will not only provide the physical exam for free, they'll also provide the blood work for free, and they'll oftentimes throw in either free dog or cat food or a discount for future medical visits. So it's worth talking to your local ER vet or your local veterinary specialist to see if your dog or cat can be a blood donor. Most importantly, know that emergency vets and specialty clinics have the ability to do blood transfusion medicine, just like in human medicine. So if your dog or cat is severely ill, really anemic, has underlying kidney disease or feline leukemia, when in doubt, work with your veterinarian or your ER vet or specialist to find out if a blood transfusion could potentially save your pet's life. Well, that brings us to the end of today's show. Find me at drjustinelee.com, on Facebook at Dr. Justine Lee, or email me at drjustine@petliferadio.com. With that, we're out of time, and we'd like to thank Mark Winter, our producer, for making this show possible. See you at the next episode.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.